Hi there, Dress for Success. My name is Dr. Ann Park, and I'm a women's psychiatrist and coach, and I'm here today to offer you some tips for feeling better, feeling happier during these very challenging times that we're in. So I want to share with you today a technique that I call the LIFT technique. The L is for labeling our difficult emotions or moods. The I is for investigating how we feel. The F is for fact-checking. And then the T is for talking to someone. So L. Why does it help to label what we're feeling? Well, if you've ever come in from a difficult day and noticed just a swirl of emotions all over, you know that sometimes can feel very overwhelming. When we label, when we specifically take note of what we're feeling and even write it down, we can actually engage the rational part of our brain to speak to our emotional centers and help ourselves to feel calmer and better equip us to think through the challenge that we have ahead of us. So the first step in our LIFT technique is to label and write down what we're feeling as specifically as possible. Now, what about the I? When we investigate our emotions, there's two things that we don't do. One, we don't try to solve them and fix them right away. And two, we don't run away from those emotions. But this third step, which is to simply investigate, is a mindful approach in which we just learn how to observe and sit with what we're feeling, even if it's uncomfortable. We know that the longer we simply sit with a difficult emotion, it begins to soften a little bit and becomes a little less scary. So the I step of investigating is simply getting used to sitting with, in small doses, what feels uncomfortable. And that in turn makes it a little easier to handle it. Sort of like when you first learn how to swim, it feels really scary at first, but if you just sit in the pool a little longer, it becomes easier and easier to manage learning how to take those first strokes. Then what about F? F is fact-checking. And what this part of our technique does is it takes our automatic assumptions and it puts them on pause and gives them a little bit of a drill, right? So it might take an automatic thought that you might be having. For example, okay, things didn't go well during that interaction with my partner or at work, and that's all my fault. And we stop and we look at that and we start to fact-check it. We start to ask ourselves, hey, is that really true, or is there another way of thinking this through? Is there an alternative explanation for what I just experienced? And you ask yourself to look for evidence that might support an alternate idea or an alternate explanation, and proof that might lean away from our first assumption. So the idea is that just because we feel something doesn't mean that it's a fact, and the fact-checking step allows us to separate feelings from actual facts. And then lastly, talk to someone. So if you had a broken leg, if you noticed like a bone sticking out of your foot, you probably would go and find help. You'd go get a doctor, you'd go to a nearby clinic and say, hey, I need something for this. Oftentimes when it comes to emotional pain and distress, we tend not to reach out as quickly, maybe because we can't quite see those emotions the same way that we can see a broken bone. But our body is both mind and our physical body. So if you find yourself in a position where emotions feel overwhelming, difficult to manage, it's a perfect time to reach out to someone and ask for extra help. That's a very wise thing to be able to do. So in summary, our tip for the month is LIFT. Label your difficult emotions if you're having them. Investigate them. Just learn how to sit with them a little bit. Fact check. Don't assume that just because you feel it, it's a fact. And then lastly, talk to someone if it becomes difficult to manage on your own. And with that, I wish you the best for the month ahead. Thank you.